What if we told you that a new revolution in Africa isn't being fought with weapons, but with scalpels, surgical masks, and solidarity? What if, instead of importing hope from foreign hospitals, we built it with our own hands, on our own soil? This is not fiction. This is the story of Burkina Faso, a country long underestimated, now performing a miracle of modern medicine that marks the beginning of a healthcare revolution for the whole continent. Before we continue, please like this video. When you do, YouTube recommends it to more people who care about African stories told by African voices. Together, let's amplify this historic moment. In a world where headlines about Africa often focus on conflict and crisis, it's moments like these that demand our full attention, because they prove, without question, that Africa is capable, resilient, and rising. Burkina Faso, a landlocked West African country often portrayed as embattled and economically challenged, has just performed its first-ever successful kidney transplant. This isn't just a medical achievement. It's a bold declaration of sovereignty, resilience, and self-determination. The story unfolded under the leadership of President Ibrahim Traoré, whose commitment to national health development made this feat possible. A delegation of Burkina Faso medical professionals, joined by Turkish specialists, announced the success with humility and pride during an official visit to the presidency. They came not just to report a medical victory, but to express profound gratitude for the government's unwavering support. Their words were more than ceremonial. They were heartfelt. We are deeply honored to have been received by the highest authority of our country. This transplant marks a giant step forward. But what exactly happened, and why does it matter so much? Let's go back to the heart of the matter. For years, countless Burkina Faso citizens suffering from kidney failure were forced to seek treatment abroad. Traveling for dialysis or transplants became a luxury only the privileged few could afford. The rest, ordinary citizens, mothers, fathers, teachers, farmers, were left with little hope. Today, that reality begins to change. Thanks to a groundbreaking partnership with the Turkish Foundation for Organ Transplantation, Burkina Faso doctors worked side by side with experienced Turkish surgeons to conduct this first transplant. The operation was successful. Both the recipient and the donor, ordinary Burkina Faso people, are in good health, receiving professional follow-up care in safe, well-equipped conditions. Let's pause for a moment and reflect on what this means. This wasn't a medical tourism trip to Europe. This wasn't an elite procedure behind closed doors in some private clinic. This was Burkina Faso professionals treating Burkina Faso patients on Burkina Faso soil in collaboration with partners who respected local ownership of the process. It's not just about one surgery, it's about rewriting the narrative of African healthcare. And this is only the beginning. During the announcement, the Turkish delegation shared even more exciting news. Plans are already underway to expand the transplant program to include liver, corneal, and tissue transplants. They also committed to reducing Burkina Faso's dependency on foreign health systems, slashing the high costs of care and making advanced treatments accessible to more citizens. They stressed the goal of building Burkina Faso's long-term medical capacity, not just performing a few symbolic operations. To support that vision, they've already launched a 2-day intensive care training program, led by the Turkish Association of Intensive Care, right in Ouagadougou. This is just the beginning, they said, and you could feel they meant it. There's something quietly revolutionary about this kind of collaboration. It's not about aid, it's not about dependency, it's not about rescuing Africa. It's about equity, exchange, empowerment, and perhaps most importantly, it's about Africa taking control of its own future. For decades, Africa's most talented medical professionals have been trained abroad, only to stay abroad. They're often unable to return home due to lack of equipment, infrastructure, or political will. Burkina Faso is flipping that script. Instead of exporting its sick and its doctors, it is importing innovation, building systems, and reclaiming its health sovereignty. And let's not overlook the symbolism. In a nation that has faced political transitions, terrorist threats, and economic challenges, this kidney transplant is a message of life, a symbol of healing, and a testament to the strength of the Burkina Faso people. It's also a call to other African nations. If Burkina Faso can do it, amid hardship with limited resources, what's stopping others? Why are we still seeing thousands of Africans flying to India, France, or South Africa for transplants? Why are national health budgets still being drained for evacuations instead of investments? Why is it easier to fly across continents than to get a diagnosis in your own capital city? This is why the Burkina Faso transplant matters. It proves that another path is possible, a path of local excellence and regional leadership. The team behind the transplant didn't work alone. The procedure was the result of a political framework supported by two ministries of health, Burkina Faso and Turkish, working in synchrony. Their collaboration was founded on trust, transparency, and long-term planning. Most importantly, the procedure was carried out ethically, respecting the dignity of both the patient and the donor. This is critical, because if Burkina Faso is to build a full-fledged transplant program, it will need to develop and enforce strong ethical standards to ensure organ donation is voluntary, safe, and accessible to all. Public education will also be key. In many parts of Africa, cultural fears and misinformation about organ donation persist. By launching awareness campaigns, training community health workers, and involving religious and traditional leaders, Burkina Faso can begin to normalize donation culture while respecting the country's values. It won't be easy. There are still gaps in infrastructure. There's still a need for more trained specialists, equipment, and a national organ registry. But if one transplant was possible, so are 10, 100, 1,000. This story is not just about science, it's about hope. It's about saying to every Burkina Faso child who dreams of becoming a surgeon, you don't have to leave your country to save lives. It's about saying to every patient on dialysis, there is a future for you here, in your homeland. It's about saying to Africa, your healing is in your hands. The President's office acknowledged this milestone with dignity. But what's most telling is the emotional reaction from ordinary citizens. Social media in Burkina Faso lit up with messages of pride, joy, and gratitude. Many called it a miracle. Others called it a new dawn. Parents posted photos of their children with captions like, "This is the Burkina Faso I want for them." And rightly so. We live in an age where too often the good stories go untold. But this time, the world must take notice. Because what happened in Ouagadougou is not just local news, it's continental history. This isn't just about medicine, it's about a nation that refuses to be defined by its challenges, a nation that chooses life over despair, progress over paralysis, sovereignty over dependence. As the Turkish team departed Burkina Faso, they said they were proud to be part of this story. "We are always ready for cooperation," they said, "and happy to continue." That's the spirit Africa needs more of, mutual respect and shared victories. Imagine a future where African nations partner with each other in transplant medicine, where a Burkina Faso surgeon trains a Ghanaian intern, where a Kenyan donor registry helps a Malian recipient, where the AU doesn't just talk about development, but funds regional medical centers of excellence. This is the dream Burkina Faso has begun to build. But dreams need defenders. As we celebrate this first transplant, we must also demand sustained support from African governments, the AU, ECOWAS, and private stakeholders. Let this moment not be a one-time headline, but the first line in a new chapter. Because when Africa heals itself, it will rise like never before. Brothers and sisters, if you believe in the future of African healthcare, share this story. Like this video so others can see it too. Let's flood the internet with hope, not just hardship. Let the world know that Burkina Faso has done what few believed it could. And now it is leading Africa into a new era of medical self-reliance. May the patient and donor continue to recover in good health. May this cooperation with Turkey bear more fruit. And may every African nation soon follow this inspiring path. The future of Africa is in African hands,